There are so many times where someone has a legal need that they can't recognize for themselves is a legal need. So if they're at Cherry Health and they can be screened by staff here, then they can be referred to an attorney instead of needing to self-identify that they have a legal issue.
The mission of Cherry Health is really to take care of patients and to use innovative strategies to try to optimize their lives, their health, and their well-being. Separately, we have in Grand Rapids a legal community that is committed to this population as well. These two sectors can join together and really move the dial for this community in a way that I don't think we've seen before.
Whether it be blood pressure, headaches, stress causes, as we know, a lot of different physical issues and manifestations. So it's important to deal with the legal issues to relieve that stress, relieve that burden on a person.
I had suffered multiple traumas as a child, and there were some traumatic experiences when I was in New York. When 9/11 happened, it was the kind of the straw that broke the camel's back. In 2008, I had a heart attack. I had actually been working as an acoustics consultant at that time, and when I had the heart attack, I lost my job and I also lost my apartment. So I had to pack up all my stuff and move out, and I was homeless for a year and a half. I was just absolutely a mess. I was pretty non-functional. The PTSD was debilitating. A lot of times I didn't dare go out of the house. I hadn't filed my taxes in a bunch of years. That was the last thing, that was not even remotely a priority. After struggling for a long time, I ended up with Cherry Health and the Durham Clinic, and now we were starting to look at things with me as a whole person. And now I'm saying, well, geez, I really need to take care of these taxes. And I mentioned this to my health coach, and he said, hey, we actually have a partnership with Legal Aid.
He came to me very stressed. He had been getting all sorts of notices and communications from the IRS and hadn't even opened them. The first meeting, I think, was opening up a lot of envelopes and putting the history together in terms of what's going on and what the debt is.
So I just had a bunch of stuff, and I said, well, here's what I have right now. I probably have some more things elsewhere, but can we deal with this? We're working on that with the IRS now, and again, I don't feel that huge burden. That was a really huge relief to have a resource like this that can take people and help them from some pretty hopeless looking situations to come together as a whole and really get back on their feet. I could have been on disability right now, but I'm not. I'm working, and I'm living.